very good day to Dr. Sumaya and my fellow friends. We are from Team WQ Bar Kelana Jaya. From the 3rd of January to the 12th of January 2024, we had carried out a 2 weeks of community placement at WQ Bar Kelana Jaya. And throughout these 2 weeks, we had actually made a lot of observation, and here we are trying to summarize what we have observed throughout these 2 weeks. So we came to our very first question: what is community-based rehabilitation, or in short, CBR? A CBR is an approach to rehabilitation that aims to enable people with disabilities, or in short, PWDs, to access and participate fully in their communities. A CBR actually emphasizes in the importance of local resources and community support network to address the diverse needs of individuals with disabilities. So basically,
Assalamualaikum and hi, my name is Haikal. I will explain some of the concept of community-based rehab. First of all is community participation. In the center of the concept of CBR is the involvement of communities in the rehabilitation process. Community members, including families, local organizations, and authorities, play an active role in identifying needs, providing support, and implementing solutions. Next is holistic approach. CBR takes a holistic approach to rehabilitation, considering the physical, psychological, social, and economic needs of individuals with disabilities. It addresses not their only functional limitation, but also the environmental and attitudinal barrier they face. And lastly, inclusion. CBR promotes the inclusion of people with disabilities in all aspects of community life, including education, employment, healthcare, and social activities. It seeks to break down barriers that prevent individuals with disabilities from fully participating in society.
well, there are several challenges faced by the community at WQ Bar Kelana Jaya. First and foremost, the community is having lower accessibility to the premise. In other words, certain patients who does not have their own transportation may face difficulties traveling to the premise. It is because WQ Park Kelana Jaya is located deep in the residential area and quite far away from major public transportations, such as the LRT station. Therefore, this will be very inconvenient for people with disability and wheelchair users who wants to visit the premise, especially when they are not being accompanied by any chaperones or family members. Besides, the community also had to incur higher expenses for their rehabilitation sessions. It is because WQ Bar Kelana Jaya is a private rehab center with advanced rehab equipments. This is why the price is slightly higher than any other government premise. On top of that, the community also had to pay for any other additional costs, such as transportation costs. Therefore, despite of there's a subsidies provided by welfare organizations such as SOCSOs, the price still remain relatively high. Apart from that, the community members also have personal factors that give rise to the challenge in their rehab program. This may include psychosocial factor and the lack of family support. In one of the cases that I observed, there's a stroke case where the patient faces post-stroke depression. This is not an optimistic situation, as it will likely to lead to low motivation and the development of fear and reluctance to cooperate with the therapists, thus reducing the efficiency of their rehabilitation plan. Besides, the lack of family support is also said to be a challenge for the community, as the family members plays a crucial role for the patient rehab plan. In this context, the family members can monitor the patient's progress in their rehab plan and also provides sufficient mental support and motivation to the patient. Besides, the premise occasionally faces a shortage in therapists when there are hectic appointments. In this case, the therapist had to multitask and handle 2 patients at once. Therefore, some patients may not be able to receive one-to-one comprehensive care from the therapist. Last but not least, the community also faces limited spaces for treatment when the premise is packed with patients. For example, there are the lack of treatment cubicles at the premise itself. The cubicle sometimes is very crucial for the premise as due to the fact that the premise need to concerns and take the patient's privacy into consideration during their treatment plan. Therefore, many cubicles is required during the treatment plan. And in this case, this actually poses a difficulty for the therapists and the patients to carry out exercise and assessment. And other than that, the lack of space also gives rise to issues such as difficulties to carry out exercise and assessment that consume large spaces, such as, for example, assessments such as the 6-minute walk test, and for treatment would be the ambulation issue. So that's all for the challenges faced by the community in CBR at WQ Park Kelana Jaya.
Here are some ways in which we can overcome these challenges. Firstly, by improving accessibility through the provision of transport services or establishing rehabilitation branches closer to communities, we can ensure that individuals can access rehabilitation services without undue hardship. Secondly, by fostering partnership with NGOs and private sectors, we can tap into additional resources and funding opportunities to alleviate financial burdens and expand the reach of rehabilitation services. Thirdly, by actively involving family and caregivers in the rehabilitation process, we can enhance patient engagement and empower individuals to continue their rehabilitation journeys at home under appropriate supervision. Fourthly, by increasing the number of skilled staff and implementing more efficient arrangements, we can address the shortage of manpower and provide comprehensive care to all individuals in need. Lastly, by embracing innovative solutions such as home-based rehabilitation services, we can overcome the limitation of our crowded facilities and ensure that individuals receive the care they deserve in the comfort of their own homes.
In a nutshell, CBR not only enable people with disabilities or PWDs to restore their physical and functional abilities while increasing their participation in the community. CBR also raises the community awareness regarding the roles of PWDs in the community, and this also changes the view of the community and so reducing the social stigma on PWD. Despite the challenges faced by the community in accessing CBR services, various strategies can be implemented to overcome these obstacles and improve the delivery of rehabilitation service at WQ Park Kelana Jaya. So by enhancing the accessibility, leveraging the resources, as well as promoting the collaboration amongst stakeholders, CBR can effectively address the rehabilitation needs of the individuals with disabilities and foster their inclusion and participation in the society. So throughout our 2-week clinical base, our community placement at WQ Park Kelana Jaya, so we not only enhance our hands-on skill as well as the basic physiotherapy knowledge through the observation. At the same time, we learn a lot of other subsidiary elements such as the mentality and attitude that a physiotherapist should possess, communication skills, but most importantly, about our knowledge and concept on CPR and how we as a physiotherapists play the roles to help the people with disabilities in order to restore their functioning ability in their real life and increase their participation in the community, as well as raise our awareness on how we can help the community to make the community better. So here I would like to take the opportunity to thank Dr. Sumaya for granting us this golden opportunity to undergo our community placement at WQ Park Kelana Jaya. So that's all for today. Thank you.